I'd now like to introduce Lisa Vityuk. Lisa is a partner at McKinsey Company and has more than 15 years of experience in the consumer space. She's focused on commercial and growth strategies, building digital businesses, and improving customer experience with retail, consumer goods, and direct-to-consumer clients globally. Lisa is the chair of the Diversity, Equity, and Inclusion Committee in Canada, and this oversees a program that supports more than 850 McKinsey colleagues. Welcome, Lisa.
Thank you so much, Karen. Wow, what a room. It's a privilege to be here. And bonjour tout le monde. I will not do much more in French, but it's fantastic to be in beautiful city of Montreal. So women's health is such an important topic that I'm so thrilled we're talking about today. It is professional passion and personal commitment of mine. And in my work as a partner, I see a lot of companies that are thinking about how they step into this tremendous opportunity. And with our research together with World Economic Forum and McKinsey Health Institute, we really are pushing the needle on putting some numbers. And Rachel, I love when our research is quoted. That just makes my heart pump. So it was fantastic to see like lots of numbers, and there will be more numbers coming. So brace yourself for a bit. I hope everyone had a coffee refill, and we'll go for it. But today is actually all about connection, and I really hope that you also find the new faces to connect and the new ideas to connect with. So, okay. We'll be talking about closing $1 trillion gap in women's health. And this kind of research came from our shared passion for women's health. We got together with World Economic Forum, and around a year ago, we published this report that really explored what is the genesis of the health gap and how do we actually start closing it. It is underpinned by a lot of research and a lot of detail, but we will try to pull up the juicy details, as Rachel said, and really make it applicable. For one, Oprah has tweeted our slides. As a consultant, I've never thought that I would see it on an Oprah tweet. So first, a very important acknowledgement that throughout the presentation we'll be talking about women, which refers to female biology and cisgender female biology specifically. We understand that there is a tremendous need for understanding deeper all other kind of health conditions that and challenges that affect non-binary and LGBTQ communities and two-spirited communities and really taking it with care. But we start somewhere, and women is where we start. So the rigor of research basically went into understanding the conditions that affect majority of the women and create the highest burden of the disease for women, which means that we looked at 64 conditions and hundreds of papers and interventions and just compared what it does for a woman and what it does for a man. And where are those disparities? And what we found is that there were a lot of myths about women's health. And today we will be using data to debunk those myths and understand what are actually the new baseline that we should be working from when we talk about women's health. So, starting with myth. Myth number one is that women live longer, therefore they're healthier. It's actually not true. We spend 25% more time in poor health. Myth number two, and by the way, I will be talking about Canadian data just in a second, and looking for the one that is applicable to us. So myth number two is this gap is actually happening in a very old age when we are frail and it does not really impact our prime. Myth number three is that it's all about sexual and reproductive health. One colleague of mine called it the bikini health. So it's all about that area. Nowhere else it is happening. And finally, and this is one that's a bit wildering, this is a niche opportunity. I will not comment on it, we will come back to it, but 50.4% of women in Canada would definitely disagree with that. So let's dive in. So the first one is that women live longer, thus they must be healthier. So it's true that in the past 2 centuries, the lifespan of an average person increased by 30 years, which is a tremendous success. But there is a very important nuance that women didn't get a full benefit of it, because we are actually spending 24% more time in Canada in a poor health, which means these are debilitating conditions that impact our day-to-day life, but do not lead to kind of death. We're suffering more. We looked at it across the countries, and you see some variability across the countries, and like the good question to ask, what we can learn from it. Actually, women's health is very similar across. It's the men's health that is different across those countries. So the challenges that France and the US face are very similar. It's just in US, the men's health is a bit poorer, and in France, men enjoy a much healthier life, which is not translating to women for some reason. So there is a very systemic view of this is not an isolated country-specific problem, but we are facing it all together. Let's go to the second myth, that it's all about aging and really age-related conditions. In reality, around 2/3 of the impact comes in years that are affected by poor health, comes in our prime, between 20 and 70 years. And majority of the GDP impact comes from it. So these are the conditions that start affecting us very early in our careers, when we start our families or decide on where we want to be and what we want to do. So it has a profound and long-lasting impact on the choices that the women make, and it really kind of undermines their ability to be to realize their dreams, to actually go for that job or that calling that they have. And obviously, it has a tremendous impact on our productivity and our employment, because this is the time where we want to be at our prime, starting a company or investing in a company, and that's where it is happening. Myth number 3, the reproductive health, and that it's all about how women, this is the only thing that is different between men and women. In our research, we broke down all the conditions into 4 buckets, and mere 5%, just 5%, is about reproductive health. And the conditions that are only affecting women, like menopause or endometriosis. The majority are the conditions that affect women disproportionately. So let's say autoimmune disease. 80% of the cases of autoimmune diseases are in women. Or migraines, which is another kind of great example of having a very disproportionate impact. There are also conditions that affect both men and women, but for different reasons, we have a very different treatment of it. And the effectiveness of it is very disadvantaging women. So cardiovascular diseases would be an example, and woman is 7 times more likely to be discharged during or after heart attack, just because our symptoms do not match. We don't have like a very pounding pain that is in all the textbooks. It's actually different. It might be migraine, it might be intermittent pain, and all the textbooks are written about men. And the whole system is operating under this very simple assumption, like women are small men. So let's just shrink it down, and that's it. In reality, and that's my favorite line, and just for those who didn't hear at the back, women are not small men. But the way that everything from our healthcare textbooks to the way that our research works, it's treating us is like small men. Not to talk about our cars, our chairs, everything that is going on there. So what we found by looking at all those conditions is, one, that women tend to suffer from long chronic conditions. Men are much more likely to suffer from broken limbs and some of the things that are kind of quicker to heal and do not require ongoing care, which is also goes against the grain of our healthcare system. That is actually not great in treating long-term chronic conditions and managing it. And obviously the second thing is that women are understudied. There is a tremendous lack of understanding of female biology that goes beyond just obvious differences that we have, while our hormones and the way that our bodies operate make many things very, very, very different. So if we look at Canada, this is not the prevalence of diseases, but the burden of the disease and the most significant ones. We see that some specific, like female-specific conditions obviously impact us a lot, but there is a lot of where females are impacted disproportionately. And many of them are connected to mental health, and Rachel was calling out that this is one of the areas that doesn't get as much attention yet. Another one I want to highlight is arthritis. Women are much more likely to get arthritis, and this is one of those conditions that is long-lasting, requires a lot of comprehensive and holistic care that goes from treatment to how ergonomically our workplace is organized to kind of day-to-day wellness management that is not well kind of designed, and again affects women in their ability to pursue the careers and build the lives that they want. So coming to the women as a niche market. I think everyone in this room would agree it's absurd, but this is still a very prevailing kind of sense of this is some kind of exotic investment that you kind of do out of goodness of your heart and not because it's a fantastic investment opportunity. So we need to debunk this myth. One of the big challenges is that data that we collected and we're building it off is very inadequate. We don't collect a full sense of the prevalence of the disease, thus we don't know how important that is. So if we take, for example, endometriosis, 1 in 10 women suffer from endometriosis, which makes it around 400 million women globally. And there are only 20 assets in the pipeline, and it takes 10 years, 7 to 10 years in Canada to diagnose a woman with endometriosis. Unacceptable. We have other similarly prevalent diseases like diabetes, which is 1 in 10 adults. And we have an array of really potent drugs that are already kind of in the pipelines or working. And there is a lot of innovation that actually is coming from that field with LGPs and other things. So if we kind of slot endometriosis, it would be one of the biggest treatment areas right between immunology and oncology in the kind of the universe. But because the signal doesn't travel and most of the women do not get diagnosed well enough and early enough, we are losing the signal and it's not there. So that's kind of a bit of a state of the world, and for a science-based field, as I would hope medicine is, this is a lot of myth. So what is driving this lack of awareness? What is the gap that we are working with? So we synthesized like the 4 factors that we think are kind of really the drivers and the backup to it. The first one is this limited understanding of what sex differences we have when it comes to the treatments into the body. So only half of the treatments that we have on the market today have sex disaggregated data. And as Rachel mentioned, 1997 is when the Canada mandated to have women included in trials. And it was not until, I think, 2010 that the data could be reported separately. And in this half of the research that we have sex disaggregated data, 66% disadvantage women. And I get it. Women are very complex. We have hormones, we have cycles, things do not work as well. It is not as straightforward to get kind of a drug approved, but we are shortchanging half of the population on something that actually can save their lives. Second reason why we see this gap is that there is a constrained access to care. Even when there is a very well documented treatment available, women do not always get it. Women are assumed to have higher pain tolerance level. There is much more likely they will get an antidepressant than actually a treatment for conditions that they have. And really we are constraining it very much to really things that work and mostly work on men. We don't have the data, but I could only imagine how much worse it looks for intersectional women and some of the communities that generally have challenges in accessing care. So gap number 3 is data. We talked about endometriosis, menopause. If we're all lucky enough to live until a certain age, every single of us will be lucky enough to have some symptoms of menopause. Yet only 2 in 10 women, 20% women, get diagnosed or documented for it. Which means we have an immense gap on the signal that is not transmitted, that this is the place for you to be if you want to kind of communicate with a woman that is in her prime age. And the last one, that is, I think, is a kind of outcome on the first 3, is that investment is inadequate. Only 1% of the global investment in healthcare goes into women-specific conditions. For Canada, it is around 4%. For our UK, it's around 5%. But we're suffering from underinvestment that is really hard to break the cycle unless there is a clear call for change and the change in investment. I think that's why what Femtech Canada is doing is really important in promoting kind of both the financial benefit of it, but also just showcasing and bringing together the great companies where you can invest to. So, do you feel like a bit of outrage maybe? Maybe disappointment, maybe like the system is failing us a bit, or failing our sisters, mothers, and daughters? Well, I'm with you. It's not the state of the world we want to live in, and definitely not the state of the world that we want to pass on to the next generation. Well, I have some good news coming. It is a tremendous opportunity. Globally, we talk about $1 trillion GDP. In Canada, it is a $27 billion GDP opportunity that comes from our extended participation in the workforce and being more productive. And I think it's around 2.5% of the GDP per capita for every single working woman, or every single woman just generally, which is a great boost to our productivity and economy, which feels like we will need to stay competitive. But also it's a tremendous flywheel of the change that can be launched here. And as Rachel was saying, each dollar that we invest here gets $3 of return. And private and public companies and organizations don't have many opportunities with such an ROI. So this is imperative for us to kind of keep moving and pushing on it. And I think there is a lot of network effect, because we have a lot of things to learn from the other countries. For example, France recently passed around 500 million euro bill to support women's health specifically. UK is doing amazing things in the workplace, especially for menopause, and really pioneering and pushing it. US, hopefully they will get their act together, but they have a tremendous interest in private sector to really push the philanthropical as well as investment activity in the space. And if we win, we all win. And I think it is a place where actually Canada can be a pioneering country and could really push the needle and put ourselves on the world stage and kind of surpass the rest. At least the Femtech community is soon on the way to do that. So what do we need to do? So what is the way out of here? Because obviously we cannot sit still. It's not the status quo that we are okay to live with. And for us, it all starts with awareness. If you don't have these facts, if you don't get this healthy dose of this world cannot look like this, and it's really hard to kind of promote change. And it's both through numbers, but also through personal stories and sharing our own experiences. Second is, how do we define the sex-appropriate care? And what is okay from our healthcare standpoint, from our insurance standpoint, to do differently for women, which goes beyond our reproductive health, which is very important, but not all of it. Third is around collecting the data and making sure that we don't just, like, we have this opportunity to collect it, so let's not just do gender, let's understand all the intersectional implications, because we are biologically different, and there are different odds for us to get the right treatment. The fourth is very important around closing the gap in research, and where we don't have a great treatment or great solution, really pushing the envelope there. This obviously needs quite a lot of funding, both private and public. And finally, the policies and actions that can support it and really make it not quite mandatory and important. And as I talk with life sciences companies, for example, their realization is that we are all women health companies. In majority of the kind of therapeutical areas, women are the majority of recipients. So this is about everyone's role in it. So I will come back how to bring this ecosystem of stakeholders together in a bit, but for now I just wanted to talk about funding a bit more. And we found that this is one of the, first, apologies for a really dense slide. This is our preview of the new report that we will be launching at Davos together with World Economic Forum on investment. Because we saw it as a key unlock for the 2030 kind of horizon to really move the needle on women's health. So we started looking at what are the specific areas where the prevalence and importance of the disease is absolutely not reflected in how much it is funded. So, for example, around 80% of autoimmune diseases are with women, but only 7% of the research budget goes with women-specific lens on it, which means the models, the kind of patterns, and sometimes even trial participants are mostly men, or a bit blinded. The second area is cardiovascular and like heart attacks. Women are more likely to die after the heart attack. And yet we are not spending enough time and money to understanding what are the specific physiological changes and causes of it. It is just 5% of the budget that goes there. Alzheimer is another one, and kind of the one that is close to kind of my heart or my lungs, I would say, is the lung cancer, which is women are twice more likely to be affected by lung cancer if they are non-smokers. So there is a lot of mechanics that is going on that is different, yet we don't kind of dedicate a lot of funding to that, and the funding is much lower than, for example, promoting non-smoking environments, which do not help women, as that's not their cause of what they're doing. So keep your eyes peeled. We will share through the Femtech network the new report as it comes out. I think in January it will be public. But we are really digging deep into what leads to this gap in the financing and where the need is the most acute. And hopefully we can redirect some of the focus and the money into it. So let's talk a bit about where money is going today. And the venture capital space, which is booming and is exciting. Often when I talk to my consumer or investment clients, I portray the journey of a woman. And we often say, okay, there is a woman and she needs something. But in reality, it's a full journey that is going through like her very early pre-puberty age until kind of senior time. And our needs and goals are really evolving throughout. We figuring out our bodies, the changes, some of the onset of like chronic conditions, Then we go into young adult and we don't want to get pregnant, that we really want to get pregnant. And then it's all kind of this journey and kind of it unfolds in parallel with our lives. But it's really important to understand the context in which we are operating. And each of these market segments, if I look at number of Canadian women, that is at the bottom, is a very sizable, chunky market to go after. But more importantly, we can connect the dots and help women feel like they are transitioning more seamlessly from one area to the other, from fertility or caring for young kids to caring for your aging parents, to experiencing the signs of menopause, to being sure you're in menopause. So we looked at this broad definition of Femtech, which I think was coined just in 2016 or 18, and encompasses all the different solutions, both digital and physical, that help women's health, but especially in the technology space. And we've seen that there's been a very encouraging signs of investors voting with their dollars. The number of startups that were funded grew 7 times just in the last 4 years, and this is a PitchBook data, globally, and a lot of it is North America-centric. So venture capital investment has risen significantly, 3 times over. And we see a lot of women investing in women. And finally, there is a significant kind of like good news coming. I think we're not out in the clear in terms of the number of potential unicorns. And there is still a bit of a tendency to ask, and where is your male co-founder type of question? But we are celebrating some of the big successes like Maven Clinic. So despite some challenges, on the right chart, there is an all healthcare VC investment in dark, and then in pink, the women's healthcare investment. We see that despite quite a slumpy kind of start of 2021, 2022, women healthcare still hold on very strongly. So there is a growing portion of the overall investment that goes into healthcare, and the trend is very strong. In terms of the number of startups, it is the number of startups that is founded each year. So it is around 1,000. We are kind of approaching 1,000 and more that are coming online every single year. And we have some exciting stories. And I love kind of exciting stories from Canada as well that get the recognition and funding that they deserve. If we think about the landscape, though, like let's pause on the new startups. It is a very crowded landscape, but frankly, not a single company has figured out how to stitch together something that make real sense for a woman across the different sides of her journey. So we have the biopharma, we have devices and diagnostics, we have consumer companies that are very actively looking at menstrual health and fertility and what they can do in the menopause space. So there is a sense that there is a lot of happening, and many of these companies have incubators or even VC arms that are interested in scouting the early side of the companies. The Femtech startup is also covering a very wide range of the field, and the two that are a bit more mature are fertility and gynecological care. We have more than 500 startups in that quadrant, and their funding is pretty high. General health is one that has been on the rise, both in kind of virtual care as well as in-clinic care. And the two that are growing the fastest are the menopause and oncology. And again, it's like on the global level and a bit skewed to US. With menopause is exactly the same story in Canada. As in Canada, there was like literally 0 companies that were funded around 5-6 years ago. And now this has been a wave of companies that go from providing solutions to actually doing the insurance that is catered to to menopause specifically. Canada has lots of local champions, and the kind of 160 plus companies that Femtech has is fantastic. And I do really hope that with a bit of uncertainty in the global markets, that's where we can take an edge and really push the boundary and push the thinking and become some of those global champions. At least we have 2 languages already, so we have at least 4 of the top largest markets that we can cover. Maybe to kind of, and by the way, if you really have a question, please raise your hand. If I'm speeding up too much, please kind of pause me. But I really want to make sure that we get to a bit of a conversation and discussion towards the end of the presentation so that we can exchange the ideas here. When we started mapping, and we're consultants, we are very kind of analytical and we map. If there is no 2x2, it's not a good presentation. So I told. We started mapping where does the activities actually, where activity is actually happening. And some of the areas that are kind of red lit are the ones where we have at least a large number of the startups that are going. It's like maternal and sexual health and a bit in fertility. But even there, the benefits and financing and health services as well as home testing is really lagging behind. And then we have like this wide field right to the right side, which means that we really are lacking some of the basics on the menopause, on oncology, on some infectious diseases. And these are the spaces, if there are ideas brewing in your head, maybe these are the spaces you should look at. I will kind of recap with a couple of innovation themes that we hear a lot in the market. AI and machine learning as a means to the end, but really using the benefits of big data collection and analysis to close this knowledge gap about how women biology works and creating models of women bodies not in like decades, but in weeks and months. This is a really important field that kind of will continue to be prevalent both in the enterprise solutions, but also with kind of consumer devices and telling us more about our own bodies. I think wearables and smart devices, pretty self-explanatory. The approaches to care and acknowledging that women just do not have time to get to their family doctor or get through all the appointments that they need, and being much more on demand on where and when we need it is a huge area to really closing the gap in access to care. Fertility solutions that don't just tackle one problem but work comprehensively and use a lot of data. The non-reproductive focus areas that we talked about and some of the gaps in autoimmune diseases and cardiovascular diseases and asthma and other places where we just don't have great solutions that work for women equally as well as for men. The unmet needs in life sciences. One of my clients, a retailer, they are really innovating, for example, in space of providing patients for trials. They look at their consumer base and customer base, and they select the people who might be well suited for trials, and they can follow them longitudinally and actually look at their families and their patterns. So how do a broader ecosystem come together and help kind of close the gap in research? And finally, the solutions for some of the taboo conditions. Incontinence is a good example, hot flashes, things that we don't want really to talk about, but we need to talk about because otherwise we're not giving ourselves justice in how we can address them. And obviously, the more holistic menopause, like those who live in Ontario probably saw a lot of billboards with the hot and bothered. Was it the logo there? But this is the first step on like opening the workplace conversation, and I've had quite a lot of conversations with my clients and my kind of internally on how do we kind of make it as normal as a nursing room that we are helping to provide the support that a woman needs. Okay, so let me just close by saying that it is complex. It is not easy. It is extremely rewarding, both kind of for us to think about the million years of better lives that we can give to Canadian women, as well as billions of dollars that we can put in the GDP. And I do sense there is a once-in-a-generation opportunity for us to solve it. So I really hope that today you find yourself inspired, you connect at least with one person that you didn't know, and you kind of feel sparkles of new ideas, and you come out like a bit emboldened. We all need a hug. I think so. Like we're talking what we're looking most for today. It is the area of the future, and we just need to keep going in our very womanly, resilient way. And I really appreciate everyone's time and attention and the passion and the courage that you are giving to the space. So, thank you.